My name is Mike Robichaud and I'm the program coordinator for the Give Fresh program.
Hi, I'm Heather Zimmerman. I am a Major Gifts Officer.
Hi, I'm Erica Moore. I'm a Special Events and Development Officer.
My name is Andrea Land. I am the Manager of Patient Guest Services.
Hi, I'm Melinda Spradling. I'm a Special Events Coordinator and Development Officer for the regional hospitals.
My name is Gregory Arewa. I am an accountant.
My name is Sterling Rowell. I'm the Coordinator and Manager of our Adult Volunteer Program and our Postpartum Delivery Suites.
My name is Amanda Smith and I oversee and implement our Grateful Patient program.
Hi, I'm Krishna Ellington. I'm a Major Gift Officer and my primary role is employee engagement.
Hi, my name is Cindy Gregory and I'm the Senior Major Gift Officer.
I'm Jim Gibbons and I'm Volunteer Services Manager.
My name is Marcy Atkinson and I am an Innovation and Marketing Specialist.
And my name is Erin Childress and I am a Special Events Coordinator and Marketing Assistant.
What excited me about coming to work for Baptist Health Foundation was the opportunity to serve individuals outside of the walls of the hospital. I'm able to see the impact that the regional fundraisers have on the individuals out in the communities and the way that the hospitals can support those families in need.
A large component of my job is conducting patient visits in the hospital. It really hits home when I'm able to connect with that patient. Sometimes I'm able just to help them out in a little way by getting them a newspaper or maybe getting them a cup of coffee. You know, it's just something little, but just making the patient and their family member feel as comfortable as possible in the hospital. We recently launched the Grateful Patient program in Arkadelphia, and it has been very successful. We had a Grateful Patient ceremony there about a month ago, and the patient, she made a monetary donation and in addition wrote this fabulous letter talking about the care that she received. In addition to that, she took out an ad in the local newspaper and submitted her letter and a picture of her with that nurse practitioner. So we're really excited about the way the program is taking off in our regionals as well.
I've been in a hospital setting for many years throughout my career. One thing that has happened to me since I've been here is my husband has had a health situation going on. And so through golf and luncheon and the beneficiaries that we have, it just means that much more to me to know that the money that I'm helping raise is supporting nursing excellence, because it is bettering our nurses to serve patients here at our hospitals that are going through situations like I have been through.
The Psalm 91 helps families. We've had families come from out of state who have medical emergencies that come up. We provided meals for them. They don't have a place to stay, so we've offered rooms, meals. We've even helped with rental cars. We had a patient come in who had to get back to a different state, and so Psalm 91 helps do that.
So the new program that we have is called GRACE, and that stands for Grace Rightly Applied Changes Everything. And it's set up to assist our employees if they experience a financial hardship due to an extended illness or injury, or they have an unexpected death in the family and they just need some help. We want to make sure that our Baptist Health employees have the best mental state when they come into the hospital so that they can continue to deliver the amazing care that we offer. I'm looking forward to the GRACE Employee Fund actually providing an opportunity to where I can engage with our employees a lot more, and that they don't see me as a face of one that is asking for money or asking for assistance, but that I'm also that face they identify with, one who offers a helping hand.
So helping to coordinate and manage our postpartum delivery suites, it's something that is passionate to me and my journey here at Baptist Health. My sister delivered last January, and Baptist Health brought our little Emma into the world. So the suites are equipped with ample seating for you and your loved ones. There's extra rocking chairs, there's a microwave, a fridge, there's a big brother, big sister sibling certificate. There's extra space and a bathroom bed for you and your loved ones.
What made the suite special and what made the experience worthwhile for me and my family was that there was an extra bed for me to sleep in. You know, Adrian actually snuggled with me. You know, we had my parents come visit, her parents come. There was another room that, you know, parents could stay, and we still had our privacy. And it was very special because at that point in time when we welcomed our children into this world, we needed all the family support that we could have.
So with the Give Fresh program, we have the unique ability to purchase local produce from our farmers here in the state of Arkansas and take that produce into food deserts and help to distribute it to people that would not normally have access to this produce. And my job, I have the unique ability to help educate these people on the cooking methods and the healthy benefits of this produce. For 20 years in restaurants, it was always about making a buck, and now it's a unique opportunity to make a difference, and I actually get to see the results of everything that we are doing. We incorporate the healthy and active youth with it, and they came down and actually bagged up the vegetables and got to take those vegetables home. And so we touched those people's lives as well, and even had at the Healthy and Active Youth graduation, somebody came back and said, we've never even had tomatoes before, until they brought them home and got to cook with them. So to see the immediate impact of what we're doing is phenomenal.
Every day I come to work and I work to connect the needs of our community with donors that have a philanthropic heart. So that's very meaningful to me. It provides me an avenue to do God's work every day. We just completed our legacy wall ceremony, and I was able to work with a family who unfortunately had a stillborn, and I was able to work with a family to name a NICU room in their son's memory. And I was there when they first saw the plaque, and we prayed together, and it just really solidified my job and coming to work every day.
I'm excited about the Baby Project, which I have the privilege to coordinate. This is a program in which we raise money to provide free lodging to families that have a baby in the neonatal intensive care unit so that they may stay near their children in those early days of life and development. As of November 8th of this year, we have served 92 families from 59 cities in Arkansas and offered 1,166 nights of free lodging. I had the opportunity to visit with a nice family, and unfortunately, the mom had 2 small children at home and had given birth to 2 beautiful new babies, to twins, and the weight of the world was really on her shoulders. And when I had the opportunity to interview her for a room at the Baptist Health Inn, she broke down and cried because she didn't have the means, she didn't have the resources. I left there with a very warm feeling in my heart because we'd been able to meet a need for a young lady in crisis, and we were able to provide for her something she couldn't provide for herself.
Our surgery waiting areas, outpatient, and also critical care waiting. These areas are stressful, there's a lot going on, and without our volunteers, we would not be able to do what we do, which is to try to provide the very best care to our families and our patients, keep them updated, and always keep them in the know so they don't have to sit there and wonder and live in the unknown. Volunteers make such a huge impact. I have personally seen with my own eyes an 84-year-old volunteer that was at the front information desk, and a woman came in the front door and was crying and hysterical because her husband had been in a car wreck. And instead of just pointing the way, he stood up, he put his arm around her, and he said, I'm going to take care of you, we're going to find him, and everything's going to be okay. And he walked her all the way back to the emergency room and made sure she was okay and taken care of, and that is the difference that a volunteer can make.
Working for the foundation is super rewarding, just in all the programs that the foundation does throughout the community and the hospital. And in marketing, we kind of have the fun job where we're out doing videos, and you know, we get to play around and have a lot of fun. But just in doing that, we get to meet the families that are affected and impacted by the work that we do and the money that we raise, and just seeing those families that are going and staying in the hotels, or maybe that are receiving a Give Fresh bag. It's so rewarding just to see the look on their face and for them to thank us and to know that I was a part of that because of the donations of the people in this community.
You can work a lot of places and do a lot of the stuff that we get to do. A lot of places you can create, design, and play and do all the stuff that, you know, kind of expresses your creative outlet, but there's nowhere else like the foundation, and that all of those things come together to make an impact and help the foundation make its mark and make an impression and pull people in and get people connected to the programs that all of our fundraisers and donors work so hard to make a huge community impact. And so getting to play the small role that we play in that is awesome, and it's fun, and it's just, you know, the kind of thing that you wake up and you're excited to go to work.
I enjoy working at the foundation because it is one big family. And I'm so proud that I can work at an institution that provides family-centered care.
I feel like at the end of the day that I've done something important, and that's why I love what I do.
It's a blessing to know that what we do, we come to work and do, changes people's lives.